in our work, in the last about 90% of these that our doctors have seen in our centers are related to infectious diseases. And what happens is when a patient has an infectious disease, can you turn the slide? If I remember this correctly, they'll go to the doctors, they're put on typically steroids or pain management, but they're not treating the disease. When you ask a physician what causes autoimmunity, we either say we don't know or it's idiopathic, which we don't know what it is. The reality is, when you look at particular infections, go ahead and turn the slide if you wouldn't mind, Mark. When you look at particular infections that people can pick up anywhere, okay, airborne, sexually transmitted diseases, in a number of different factors, when the patient's immune system is intact, they can deal with this. All of us have infections. But when people have weaknesses in their immunity, they become susceptible. And an infectious disease has a very sneaky way of causing autoimmunity. Can you turn the slide again, Mark? See if I can get a good image up here. These are lists of more infections. Go ahead and turn the slide again. And one of the things, the way that these infections work, I want to show you. This is particularly the one our chief medical director, Dr. Korn, particularly loves: Lyme disease, Borrelia, one of many tick-borne infections. But there's a number of infections people can be exposed to. Do you see this like squirrely, snake-looking like subject? What that does is it burrows into tissue in the body and it spreads its antigens on tissue, and then it moves. And what happens is the immune system figures out, okay, we know what your antigen looks like, and it goes to attack the antigen. But one of the survival mechanisms of the infection is what? To spread the antigen to divert the immune system from going after the infection itself. It's very intelligent. And it's even more complicated than that. They send out messengers. They burrow themselves sometimes inside of white blood cells where you cannot find them, like ehrlichiosis and other infections. And we see leukemias and lymphomas. You see where I'm going here? You will never hear this by the standard medical community because you would never have an oncologist treat an infectious disease unless the infectious disease is secondary to a decreased immune system caused by chemotherapy or radiation. But it's not part of treating the full patient. So once you bring the patient into remission, the next job is to find out what caused the cancer and then go after it. Would you change the slide? Okay, so this is what they call the great mimicker. Over 360 different diseases that mimic the exact symptoms of neuroborreliosis or Borrelia or Lyme disease. And many people have these infections. Even if they don't have classic Borrelia, they may have Ehrlichia, Babesia, Bartonella. I can just keep naming them. They can have, and what happens is these infections have ways of talking to each other. Can you switch it again? Mark? There we go. Here's one of the co-infections. Remember, infections never travel alone. I think in medical school you're taught, and we're taught, that you've got strep or you got... It doesn't work like that. Infections travel in colonies, and they have biofilm communities. Think of it like a mucus that wraps around, and all these infections talk to each other. We know now that when you try to kill one infection, it can send messengers for the other infection to spike. So when we go to preschool or we play with other kids, we pick up herpes virus 6. Very common. Everybody has it almost. But it's actively replicating in patients who have immune-compromised conditions, and they have other infections like Borrelia or other that will turn on the replication of this infection. It's called self-synergistic replication. They communicate with each other. Now, what's interesting about this is linked to childhood glioblastoma, brain cancers. It's linked also to nerve problems, MS, and other symptoms. So we can go on and talk about how it's the biological soup of infections that are really important. Can you change the slide? So here's, the typical symptoms you would see in a child. We're going to change the slide. It talks about their immune and then here you can clearly see where in the conventional part of medicine we're looking for this infection. Go ahead, Mark. He's trying to keep up with us. And then you can see, okay, here's the symptoms. One of the things you'll see when you treat patients with chronic infections, in particular borreliosis, neuroborreliosis, where it's in the nervous system or in the connective tissue, Lyme disease, as you're treating them, they'll develop skin symptoms, Morgellons-like symptoms. It's like the toxins. There's a way the body detoxes, usually through the bowel, the kidneys, the urine. But if it can't come out through that way, it'll come out the skin. And so you'll see the symptoms of these patients. Go ahead, Mark. Would you rotate it? And so, there's all these symptoms related. I've just picked one little infection. I mean, we would be here all night if I went through all of the symptoms related to these infections. Can you change the slide again? And what you'll see is, this is a study that was done on all of the cancers, brain cancers related to this one infection, cardiac problems to these particular viral infections. Can you go ahead and switch that again? So patients are sick and they don't know what they have. Do they have Lyme disease? I don't like to overemphasize. Lyme disease complex should be more of a general term because people think they have this one infection when really they have a whole bunch of infections. And they may not even really have Lyme, quote, but they have a whole barrage of other infections that contribute to disease. Go ahead and another slide. This is what I was talking to you about. Do you see this? This is called biofilm communities. And what you see inside the biofilm communities is the replication. One of the newest things happening in ear, nose, and throat medicine is they're using like light, photodynamic therapy, to kill infections. They can spot treat certain areas of the sinus cavity, the oral cavity, infections, laryngeal, these areas of the body that they want to treat. What's interesting is biofilm communities are really stubborn. Antibiotics can't reach them that well. They protect. It's like a coating. You can take the antibiotic, you're not going to reach it. The other thing that they do is inside these communities, they talk to each other, and they grow. So you may have been on an antibiotic. You may say, well, I'm not feeling 100% better. You'll feel a little bit better, then you worsen, and you get a little bit better, and you worsen. You never get out of that rhythm. But the other thing that's going on within these communities is just like I said, whether bacteria or virus, they're communicating to each other. So if one goes down, the other one spikes. So you have to treat them all at the same time. Go ahead. So the common difficulty in treatment is even if you find a doctor lucky enough not to think you're crazy, that you're fatigued and you're in a lot of pain, your memory's not working right, and you might have autoimmune-like symptoms, you in the end of the day might be given an antibiotic because you're fortunate enough to live in the Northeast where they even look for these infections, and your doctor says, okay, here's Doxy, here's this. And while you're under treatment, what you will realize is that you don't ever get well. And these people are very sick. And not only are they physically sick, they have a lot of mental illness that goes with it as well. Particularly neuroborreliosis is they struggle a lot with psychological issues as well because these infections go into the nervous system and they impact brain, nervous system function. They release neurotoxins which compete with, go ahead and change the slide. This is a receptor site. By the way, all these animations we make ourselves because we have to build things that, because we're in an area of medicine that we can't just grab material, we have to actually design to explain it. This is a receptor site of what, let's say, a hormone receptor site would look on a cell. And you see, actually, for Dr. DeRosa's lecture, it would be nice. This circular ball would be like what a bioidentical looks like, as it fits in beautifully. And the synthetic would look like a big box. It doesn't really fit the receptor very well and causes other problems. But here, what you're seeing is the receptor sites, you can see we put an X over them. They're being blocked by neurotoxins. One of the function of infectious diseases, particularly Borrelia, is to spin off a bacterial lipoprotein neurotoxin which binds the receptor sites. It's one of the ways of shutting down the host organism, which is us. Okay? And it's a process in which it spins off. So now you may have the hormones. You can also take a whole lot of hormones and try to compete for those receptor sites, but you're blocked. So it's very difficult. You'll go through swings where you feel better and then you feel worse, feel better, and you feel, because you're competing with the neurotoxin. So you have to actually deal with neurotoxins, and it can take at least up to a year to really get some good clearance on a very sick patient with neurotoxins. And look at this. The infectious disease is a whole body disease. Look at this. It affects hormones. We know the insulin receptor sites, the nerve receptor sites, the communication between nerves. It also blocks those receptor sites. So basically, you would have a patient who feels horrific, can't get well, really, really, really in bad shape, and you can see why. Those are all the major functions we need basically for survival. Those are very important ones. And so patients have these devastating symptoms, and you can't put it all together because it's a systemic problem. Next slide. So the problems, again, and I would say this for hormones too and anything, the problems is testing is not done accurately unless you're working with a specialized doctor in that specific field. Testing is really it's not really a science yet. You know what I'm trying to say? It is, you can send it to a laboratory, it looks like a science, but it's really still imperfect. You get a lot of results that, this could be right. So the doctors who work in these fields learn to work with the laboratories that are specialized in these areas, which then give us the accurate results with clinical presentation all the symptoms, the doctor caring and listening, and then you put that all together, and then you have a real diagnosis. So it's not as simple as running a lab test, because a lot of times you'll get false negatives for a number of reasons I can't go into tonight's lecture. We don't have the time. But it's partly because of the way the tests are conducted and how the tests, different labs use different markers for their Western blots. They use different techniques for the Western blot. Can you change that? But here's the, we just picked the spirochete. Now, interestingly enough, Borrelia is in the family of syphilis. They're both cousins, if you will, related to each other. They're very same shape. They move in a corkscrew-like motion. And you can see here on the dots, you see the dots on that? Those are the antigens. That's their markers. Can you change the slide again? Here's a three-pronged picture of the immune system and the way it responds to an infectious disease. By the way, we know this well because we develop cancer cell vaccines using the very same part of the immune system. To the far right is a dendritic cell. Do you see how it has all its arms out like this? Basically, the job of a dendritic cell is to feel out the infection, grab the antigens, pass that information to the helper T cells, and then activate the natural killer cells. Okay? Now, when that go ahead and when you turn to the next slide, that spirochete burrows into healthy tissue like this. Go back up to the slide you just gave, Mark. Go backwards one. Go back again. What you see here is first the spirochete will pass the information here, goes to the natural killer cell. Now the natural killer cell is wired and ready to go after what? The spirochete, right? Turn the slide. It's burrowing into the tissue. What is it doing at the same time? It's spreading its antigens onto healthy tissue. So the cell doesn't know where to go. Self-attacking self is the definition of autoimmunity. That's one explanation. It gets even more complicated than that. But that is an infectious disease originated autoimmune disease, and many, many people